Welcome to Healthy Choices Unlimited. This video serves as an introduction to medical marijuana for new Colorado patients. Throughout this video, the words cannabis, the botanical name for marijuana, and marijuana are used interchangeably as they mean the same thing. Cannabis has been used as a medicine since ancient times, way before the invention of glass. In Colorado, medical use was approved by voters in 2000, and you can currently obtain a Colorado Medical Marijuana Registry card with a doctor's recommendation for the following 8 conditions. And they are cancer, glaucoma, HIV or AIDS, severe pain, severe nausea, muscle spasms, including multiple sclerosis, seizures, including epilepsy, and cachexia, which is physical wasting. That's weight loss with muscle loss. So if your condition isn't on the list, what do you do? Well, adults over 21 can still talk to our doctors about trying marijuana purchased recreationally as a treatment for other issues. Examples of conditions that may benefit from cannabis but aren't currently on the registry list are insomnia, anxiety, Alzheimer's, post-traumatic stress disorder, mood disorders, and others. For all conditions, this is a recommendation and not a prescription. If and how you use marijuana is up to you. There are 4 members of the cannabis plant family: Cannabis sativa, indica, ruderalis, and hemp. Cannabis sativa, indica, and hemp plants are often crossed to form hybrids. The different plant variations formed are called strains. Strains can have funny names like purple voodoo, headband, lemon haze, blue dream, and cheese. The important thing to remember is to not worry about the strain names. The cannabinoids present are more important. Look at the lab test results for each medicine. So, what is a cannabinoid? Well, there are over 483 chemical compounds present in each cannabis plant. This includes 84 plus chemical compounds found only in cannabis family plants, and these are called cannabinoids. The human body has receptors that recognize these cannabinoids. These receptors are part of a body system called the Endocannabinoid System. Every single person has an endocannabinoid system because our bodies make cannabis compounds naturally. The 2 most common plant cannabinoids are THC, Tetrahydrocannabinol, and CBD, Cannabidiol, but there are many, many more. All of them work together to have a protective effect on the gut, brain, and organs. THC, Tetrahydrocannabinol. THC starts out as non-psychoactive THCA or THC acid in raw plants. When dried or heated, THC becomes the chemical that makes you feel euphoric, giggly, high, or stoned. It tends to be present in higher amounts in sativa plants than in indica plants, and there's almost none in cannabis hemp. CBD, cannabidiol, is the second most common cannabinoid. Up to 40% of the cannabinoids in medical marijuana are CBD. It's non-psychoactive. It does not make you feel high or stoned. It's safe at any dose, but it can cause drowsiness. CBD regulates the effects of THC. It tends to be present in higher amounts in indica plants than in sativa plants, and it's the main cannabinoid found in hemp plants. At first, CBD was thought to be an inactive compound because feeding it to animals did not produce the same effects as dried THC. So, common forms of medical marijuana. The fastest way to get cannabis into your body is to inhale it, and that means smoking, vaporizing, or concentrates or dabs. Inhaled cannabis takes effect very quickly. You feel it within 1 to 5 minutes, and it wears off quickly as well. The effects only last from 1 to 3 hours. But at 500 degrees, lighting your marijuana with a flame destroys some of the medical compounds, and carcinogens are released. Unlike tobacco, however, there are no reported cases of lung cancer caused by smoking cannabis, so the risks aren't known. Vaporizing. Vaporizing uses a low-temperature electronic cigarette. It uses either whole herb or concentrated oils. With a vaporizer, the material is heated until the chemical compounds are released, but it doesn't actually burn, so there's less waste. It's the same quick onset and short duration as smoking. The third type of inhaled medicine is concentrates or dabs. Dabs are highly potent, concentrated forms of cannabis typically made from hash oil. Like most drugs, the effects of marijuana are stronger when you first begin using it, and a tolerance develops over time. Dabs are for experienced users only. We do not recommend dabs or concentrates for people new to medical marijuana, as feelings of overdose can result. The next most common route of administration is oral absorption. This includes tinctures, sprays, mints, and gums. Cannabis extractions are dropped under the tongue, sprayed, or melted in the mouth. This means the cannabis is absorbed through the mouth membranes. It has a very fast onset, takes effect in 5 to 15 minutes, and once again a short duration. The effects last from 2 to 4 hours. Many tinctures are made with alcohol, which can be evaporated off if the alcohol burns the mouth. Skin balms or salves are topicals. They stay on the outer layer of the skin and are not absorbed into the blood. They're non-psychoactive. There's no high feeling. They work on the area applied. When you think of icy hot, think of a cannabis salve as icy pot. It's an anti-inflammatory with a medium onset. It starts working in about 30 minutes, and it lasts for about 3 to 6 hours. The next form of skin absorption is transdermal patches or gels. These contain an uptake agent that pulls them into the bloodstream. They're available in both active and non-psychoactive forms. Again, they have a medium onset, working in 15 to 30 minutes, and a very long duration. The effects can last from 6 to 12 hours. Patches are evenly dosed and can be cut into pieces. Gels are evenly dosed and can be applied in series. They can both be removed anytime if the feeling becomes too strong. Raw cannabis juice is used as a nutritional supplement to promote healing. It's normally prepared from green leaves and not buds or flowers of the cannabis plant. It's non-psychoactive, there's no high as long as the leaves are not dried or heated. It's a potent antioxidant often used to improve gut absorption and support the immune system. Edibles, however, are psychoactive. Gastrointestinal absorption, pot brownies, are very popular. Why? They have a long onset, but they also have a very long duration. Effects last from 6 to 8 hours. The problem with edibles, though, is that long onset time. Because they have to be digested before the effects are felt, sometimes they stay in the body for 30 to 90 minutes before you feel anything. So be careful with dosing. Taking one bite and waiting 30 minutes and saying it didn't work and then eating the whole thing is how most people get into trouble. They can be highly psychoactive as the effects build up in the blood, but they're also highly effective when properly used. So, how to figure out your dose? Dosing with any medical marijuana product is highly personal. What works for one person might not work as well for another, even with the same condition. And different forms of marijuana may use different doses. The trial and error method is necessary to figure out your strains and forms. Our starting doses are set low on purpose and need to be increased as directed to safely find your effective dose. Remember, marijuana is a drug and can interact with other drugs and alcohol. Keep track of any other medications and therapies you use in addition to cannabis. Starting doses. For both men and women under 150 pounds, we recommend a starting dose between 2.5 milligrams and 5 milligrams of combined CBD and THC. The important number on this is the amount of THC in your product, as the CBD is non-psychoactive. For people over 150 pounds, typically a 5 milligram to 10 milligram dose is a good starting point, and for 200 pounds and more, up to 15 milligrams can be used. That's the starting dose. After that, increase by 2.5 milligrams once per hour until the desired relief is achieved. For smoking, start with 1 puff at a time. So what do you do if you get too much? Overdosing can be a problem, particularly with edibles. This is because it can be up to several hours as the drug accumulates in your bloodstream before you feel anything. Overdose signs can be mild: rapid heartbeat, dry mouth, red eyes, dizziness, anxiety, and couch lock. Those typically go away quickly. Or they can be severe: acute paranoia, difficulty standing or walking, feeling like you're dying, and difficulty maintaining consciousness. What to do if you've overdosed? Well, there is no antidote for too much THC. Do assess whether you've had other drugs or alcohol along with the marijuana before deciding if you need medical attention. Most people do not. The best thing to do is lie down in a safe place. Try to breathe normally. Ask a friend to stay with you if you need, and sleep it off. Remind yourself no one has ever died of a cannabis overdose. For most people, medical marijuana is symptom relief and not a cure. And like most symptom relief, it works best when combined with a healthy behavior. Go play outside. Get good nutrition. Get good sleep. And try to relieve stress every day. We hope you've enjoyed this video and learned something about using cannabis as medicine. One last word from Jocelyn Elders, MD, former U.S. Surgeon General. The evidence is overwhelming that marijuana can relieve certain types of pain, nausea, vomiting, and other symptoms caused by such major illnesses as multiple sclerosis, cancer, and AIDS, or by the harsh drugs used to treat them, and it can do so with remarkable safety. Indeed, marijuana is less toxic than many of the drugs physicians prescribe every day. Our staff is here to help with questions. Thank you.